Hey there. So I've been a little sad lately, and here's why. It's because it seems everywhere I turn, someone is telling me about back surgery that they're going to be getting. And worse, they're kind of excited about it. And it's kind of disheartening for me because literally it's my mission to help people avoid surgery, pills, procedures, injections at all costs. Because it's true that 80% of the time, even debilitating back pain and sciatica can be solved without a surgery. I try as hard as I can to share information. I write articles. All I can do is, share information from my little corner of the world. So here I am again to tell you, back surgery should definitely not be your first choice. And if it is something you're considering, you really want to make sure that you've done your research and have explored absolutely every other conservative option. Some people do need surgery, okay? There are some cases where you've got serious compromise on your nerve. And when I say that, I don't mean just pain. I mean, you're losing neurological function, okay? That is 100% a sign to go and get back surgery, okay? Or you've had something traumatic happen where you've got fractures and things need to be literally put back together, okay? You need back surgery. But other than that, people can get rid of their symptoms, maybe not fast, but you can get rid of them and for the long term without surgery. Some people might be thinking, okay, well, what's the big deal? It's minimally invasive. So many people I know got it. It's not a big deal. I felt so much better. But here's what maybe they aren't telling you. First of all, there's a lot of people out there that even with a minimally invasive surgery end up with less than minimally invasive complications. You can get an infection even from a minimally invasive procedure. And once you got an infection, now you get a whole host of problems, okay? Doctors are human beings. They're not perfect. They can mess up, right? When you mess up in a surgery, it's not good. And not saying it doesn't happen a lot, but it can happen. You mess up doing an exercise, there aren't too many dire consequences that are going to happen. The other thing is when you get back surgery, the research shows that most of the time your symptoms will come back in like anywhere from 2 to 5, 6 years. What's happened during that whole time is you haven't actually done anything to get rid of the problem that's underlying, because there's usually a mechanical problem that's underlying that has led you to have these severe symptoms. And if you don't address that, it's going to come back. And then what happens is people often then get another surgery or they get cortisone shots. And now they're in this cycle of chronic back pain. Okay. It never actually goes away. And there's literally something out there called failed back surgery syndrome, because once you get 2 or 3 surgeries, they become less and less effective and you're more likely to get more. These are just a few reasons why you shouldn't get surgery. And then there's a lot of things that help that maybe you haven't tried. Definitely, if you've only tried traditional, run-of-the-mill, cookie-cutter physical therapy, you have definitely not tried everything. There are people out there, like the people in my office, who specialize in back pain and sciatica. You need to make sure you work with someone like that before you check, I've tried everything off your list. If all you've done is, chiropractic, massage, acupuncture, those are kind of what we consider to be passive modalities. There's no movement or exercise involved, which ultimately, these are the things that make your back pain better and keep it better, okay? Now, you might be in too much pain to do the exercises that are required, but that's what a physical therapist is going to help you do. They're going to help you get out of pain so that you can ultimately do the thing that's going to work and provide you with lasting results, not just short-term, lasting results. And then another thing that not everybody has this, but we've been using it in our office, is regenerative therapy. Regenerative therapy helps to stimulate healing. So if you've got a nerve that's really irritated or inflamed and you've got muscles that are in constant spasm, this treatment is going to stimulate and promote actual healing of the area so that then you can get to the movement and the exercises faster. And those are the things that ultimately end up helping you in the long term. So that's my little soapbox for today. Back surgery can be avoided, even if someone told you it's the only option, but it definitely shouldn't be your first option. So if you're considering it and you don't really want to, I'm here to tell you that there's other things you can do. I'm Dr. Carey. I have an office here in Portsmouth, New Hampshire. If you're local, I'd love to hear from you. In the meantime, feel free to click on and read the article I just wrote that talks a little bit more about everything I just shared with you. All right, guys, talk to you soon. Bye.